Hi everyone, welcome to The Girls here on SSP TV. We are back in our Laurel Mall studio. Very happy to be back in studio.
Yes, and Lori's not with us today. Sorry that she can't be with us, but I'm stuck with you.
You're stuck with me. At least we're not via Zoom. I feel like my life has become Zoom life, so it's nice to have a guest here in person, social distancing. We actually have another returning guest today, Logan Alucci, but today she is here to talk about a topic that you might not know a lot about, and we'll get to that later on in the show. It's called slipping rib syndrome. But this year, of course, we cannot go a show without talking about COVID and how life has changed for all of us here in 2020.
Yes, I think that COVID has made an impact on us, and not only with the restrictions that we are absolutely required to take, but it really has opened our eyes to the world of germs. I know a lot of the countries in Europe and whatever have been wearing masks and taking precautions for years because they had other plagues. And with the pandemic, of course, it's caused us to be very familiar with masks and hand sanitizers. And, you know, what happens when you leave the house and you forget a clean mask? It's like you have to go back home, you can't go in a store. And not only for the rules, but also for your own safety.
It makes you think, it really makes you think, and the things that you need at all times now are different. And I saw a meme recently, and it asked a question regarding 2020 and 2019. So maybe I'll ask you and see how you would answer, because it makes you think a lot as you look at the years and the way that the world changes. So what are some common things you find yourself saying in 2020 that you never thought you would be saying, you know, back in 2019, that you would never even think of saying in 2019 because it wasn't really something that you had to worry about?
Okay, for me, my girlfriend called and said, hey, do you want to meet my husband and I will go somewhere? And I'm like, where could we go that we don't have to wear a mask? Mm-hmm. So it's like, for me, she wanted to go to the Mohegan. I'm like, well, you could go in the restaurant and eat, but then you have to put a mask on. And for me, wearing a mask for a long period of time, I get short of breath.
So where's my mask, right?
Where's my mask?
Do I have
we go without a mask?
A hand sanitizer, right? Things that you wouldn't think of saying. I know I recently went out to eat, and I'm thinking, oh wait, do I need a reservation because of COVID? How long can I stay seated here because of COVID? So all these things that we never even dreamed of thinking about in 2019, and now we're living this like different life.
How about just hugging each other?
I hope it's not the new normal. I hate that term, and I hope we do get to go back to hugging and being able to sit next to someone in church. Even in church, you're thinking, oh, I have to sign up to go to church. All these different things you would never think of saying in 2019. So think about that at home if you're sitting there, like, what are some things that you never thought you would be saying in 2020 and that you would never say in 2019? People will look at you strangely if you walked into your grocery store with a mask on and gloves on.
How about now they look at you if you don't have a mask?
Yeah.
I know I was there and there was one guy walking around without a mask, and I just thought, well, you know, he probably has a medical reason or whatever, but.
And if you're watching in different states, every state's different. So if, you know, that's another thing. Am I quarantined if I have to go to certain states? We would have never thought about that in 2019, or going to Canada or going to Jamaica. So there's all these new things that we have to look at. So hopefully we'll be in the clear at some point, hopefully in 2021.
Okay, so when we come back, we're going to meet Logan Olucci, and she's an amazing, remarkable girl who just persevered to find out what was wrong with her. Stay with us.
So who watching knows what slipping rib syndrome is? I never even heard of it, but we're going to talk about it on today's show. We're going to draw awareness to this because we want to make sure that if you are suffering from slipping rib syndrome, that you can get some help. We actually have a returning guest with us, Logan Alucci. So Logan, thanks for joining us here.
Thank you for having me.
Returning on the girls.
Yes.
So thanks for coming back on the show to talk about this, as I follow you on Instagram, and I've been seeing all of the pain that you've been going through for years and years and years and years and years. It feels like, you know, you weren't getting any answers from any doctors.
Yeah, that's pretty much the truth for 5 years, so until now.
Well, first of all, you're saying years and years and years and years. How old are you?
25.
Okay, so
Yeah.
25 years of your life, you've had something wrong with you, but you just didn't know what the heck it was.
Yeah, pretty much.
So, you know, tell us a little bit about what was the first thing that happened when you and your mom probably went to the doctors and you had some complaint. How did all of this start?
So, well, it actually started, I went to college in New York City, and I would walk all the time. I would go to Soho, and I would like to go shopping and just walk around and be active. And one day, it was just out of nowhere. We were walking, my friends and and I just felt like I had severe back pain. And my mom was like, okay, you probably just pulled a muscle. Like, I'm sure that's all it is.
Right, that's what everybody
That's what you
would
think, right? Because it's out of nowhere. And I didn't have any injuries or anything. So I came home, well, back to my dorm, and the next day I woke up and it was worse. And since that day, it just got worse and worse and worse, and like just had so many other symptoms associated with it. And it really did feel like it was out of the blue. So you have a backache. Did you seek medical help? Did you take Tylenol? What did you do for it? So after, I'm not sure of the exact timeline, but after a few months, I went to a doctor. I think he was an orthopedic surgeon who specialized in shoulder repair and such. So I went to him because I was always saying it was my back and it was in this area. So people thought, okay, it's your shoulder. And I just couldn't even explain how it felt. It was so different to me. So I saw an orthopedic and he diagnosed me with something else, which then resulted in me being sent to physical therapy. And that
So how did he diagnose that? Were there x-rays? Were there blood tests? Were there physical examination?
Honestly, I think it was mostly just a physical examination, but I did get an x-ray just because I was saying how severe the pain was, and it wasn't really matching up with like what he was seeing, I guess, or feeling. So I did have x-rays and a few other imaging tests, and they all came back normal. So.
It must be frustrating at any age, but especially for parents. I'm a mom, and it's frustrating when your child is trying to explain to you that they have this pain, and you keep going to the doctors, and you know, sometimes doctors, and I know people out there watching might relate to going to the doctor and then getting no answers or being misdiagnosed. So it's frustrating. Then they say, oh, it's in your head, that, you know, this isn't really happening. So at the time after you went to the orthopedic surgeon, and then thankfully you're blessed with such an amazing family that support you, your mom's like, okay, we're going to find out what's going on.
Yeah, I mean, if it wasn't for her, I mean the rest of my family as well, like I don't think I would have even continued on with the whole search of like finding what was wrong. I mean, maybe the first year I had like that fire to be like, I want to know what's wrong with me, because you know your body more than anyone else, and like you know when something's not right.
Did the pain keep you from going to your classes and everything?
Everything.
So how did your life change?
Honestly, it feels like my whole life was just flipped upside down, because I was normal. I don't like to use that term because I don't think anyone's normal, but I was normal. I mean, I was active. I was healthy in like almost every way. I did have anxiety issues, but it was not like, it was fine. You know, I was healthy. And I mean, after a few months of this, it got to a point that I couldn't walk 2 blocks. I used to walk 2 miles. I couldn't walk up the stairs at school without like, it was just, my whole life changed.
So did you have pain all the time when you were lying down? Did you have pain? Were you able to sleep? Is it activity that made it worse? Or like, how would you define the one thing that was just saying there's definitely something wrong?
So if I would explain it to doctors this way, where it's like, if I don't get out of bed for 2 days, I feel okay. But as soon as I get up and I'm active, even for like 20 minutes, I would be like, I need to sit down right now. if I would go shopping, if I would spend the day out like I used to always do growing up, if I would go shopping, it would mean the next 3 days I'm not getting out of bed. I'd have ice packs all over my upper body. I'd be so swollen that like my shirt would be loose in the morning and tight by the end of the day. I would even get bruises from the swelling. I mean, it became a major thing.
You were so frustrated, and I don't know if this was in a message that you sent to me, but you were so frustrated that you actually thought about just filing for disability at that point.
Yeah, I did. Because at that, it progressed so much when I was in college, because I think I was a sophomore when it began, and I stuck it out. I graduated, and I'm very, very thankful for that.
Well, I applaud you for that.
Thank you. And it was hard, but I like pushed through it, and I'm proud of myself for it. But it wasn't easy. And then by the time I finished school and came home, I immediately started my career path. I started my job literally the week after I graduated, and I never got that break to like kind of recover. And I mean, there was nothing to recover from, right? Because no one thought anything was wrong. So I was working every day.
You can't see it, so you don't have it.
Right, so I was working every single day, and it was just getting worse and worse. And I did think there were many times that I would come home after work and say like, I can't do this. I'm 22, I'm 23, and I don't think I could function anymore.
So did you think at a point that it was something in your head?
Yeah.
Because you kept going to different doctors, and you're frustrated. Yeah. I've seen the pictures that you posted where your back was literally
like hunched up. Yeah.
Hunched up sideways. And you look at that, so again, all of the attention was into your back.
Yeah.
Right?
I mean, yeah, I did think it was in my head, and to be completely honest, there were times I thought like, well, maybe I'm just being lazy because I used to be active, and now like I can't work out, and maybe I would have doctors say like, well, you should lose weight, you should work out more, you should do this, and I'm like, but you need to understand like, one thing caused the other thing. I used to be that kind of person, right? And when you move and it hurts, what are you supposed to do? I can't be active. I couldn't enjoy my life at all. So, I mean, not to be like, it sounds over the top, but it's the truth. I mean, it's a debilitating condition.
I think until you go through something like that, you can't fully understand or appreciate it. But when we come back, I want you to talk about the turning point of how you discovered this, that you have slipping rib syndrome. You're watching The Girls here on SSP TV with our returning guest, Logan Alucci. So stay right here.
Welcome back to The Girls. I hope you're enjoying our show. And now we're going to get into the meat of how Logan found out what exactly was wrong with you, who the miracle person was that was able to detect what was wrong, that had a turning point in your life. So tell us that point when you finally went to the person that said, you are not thinking this, there is definitely something wrong with you.
So I guess it was about 3.5, maybe 4 years into all of this, and I went to a new chiropractor, and I went to her, and I kind of explained like, I've had all this pain in my back, it goes around to my rib cage, I've seen over 30 doctors and no one knows what's going on. And she was like, well, like, let me ask you some questions about everything and feel around. And after 20 minutes, she's like, yeah, like, you have slipping rib syndrome. It's very rare, but this is what you have. Now, keep in mind, I was diagnosed with almost 10 things prior to this, and none of them were accurate. So
here you go.
You weren't like over the top, oh my God, this is what I have.
No, my mom was like, this is it, because that's my mom. She's like, this is it. No, that's her every time. That's her every time. Even if this isn't it. This is my mom's like, that's it, Logan. Like, this is fine. You're good. But I was very skeptical because I had been let down so much. So I was like, I want to believe you, but I'm scared to believe you.
And especially when she said it's very rare.
Right.
So what did that do to your brain? You're
I was like, no way. And then she's like, I mean, we're gonna get some more tests, because I had every test that you could possibly get. She's like, let's just run some more to be 100% sure that it's not something else, just to make sure nothing was missed. But I'm telling you, like, this is what it is. I could feel it, and like everything, even down to the fact that like I could hardly see out of my left eye. Like, I was having my whole left side of my body was just like malfunctioned. It was insane. And she adjusted me in a different way than any other chiropractor. And she was like, well, how do you feel? And I remember I got off the table, or whatever you would call it. And she's like, what are you doing? How are you feeling? And I was like, I can see out of my left eye. Like, I mean, not that I couldn't see, but it was very blurred. And every part of me, like, I went home, the swelling on my back deflated. I was like, Okay.
From one adjustment.
One adjustment. I was like, I think that I'm onto something here. So
And had you been to other chiropractors?
yeah, several, and none of them had ever suggested that this was a possibility or mentioned it at all. So
And had you ever heard of slipping rib syndrome before?
never, no.
Okay. So this was all new.
All new, yeah.
How about how you went to all these doctors in all these big cities, and again, you come back to Hazleton, Pennsylvania, and you know, someone who lives maybe a mile or two down the street is the person who is the one that discovers you have this slipping rib syndrome. And I would be remiss if I didn't mention that, because we do have great doctors in the area, and this is living proof that we really have good doctors here.
And especially, like, I didn't actually want to go, to be honest, because I had been, like I said, 30 doctors. My mom was like, let's go to Dr. Stacy. I've heard she's great. Dr. Stacy Sando, she's great. Like, everyone likes her. I'm like, okay, no. I'm not going.
Well, you're over it.
I was over it.
Right.
I'm just being honest. I was over it. I didn't want to be let down anymore. And thank God I tried, because it led me to.
What happened from there then?
Yeah, so the story doesn't end there. It's not like one adjustment and you're all done. So what were some of the tests now you had to have?
So I had more MRIs, CAT scans, bone spec scans, blood work. I had it all again for the 100th time, and nothing came up. Surprise, surprise, there was nothing shown. So I continued getting weekly adjustments for over a year. While I was doing that, I started seeing some new doctors, and then I had a name. So I said to them, okay, it's slipping rib syndrome. Like, my chiropractor's certain about this. And they were like, well, I mean, to be honest, a lot of doctors don't really fully agree with chiropractic or really see the methods, which is, it's fine. Everyone has their opinions. But when I would say it was slipping rib syndrome, they were like, well, ribs can't slip out of place. I don't believe that that's a real condition. Your imaging is fine. I don't believe this is what's wrong. So I went to these doctors like confident finally, because I was like, she's the only one in 5 years that has helped me. The only one at this point. So I was telling everybody, like, I really believe this is it, because she's causing me to feel better. Not perfect, but I'm seeing improvements for the first time in years. And until the surgeon I found, no one believed that it was real.
How did you find this surgeon that you went to?
So actually through Instagram, because during the pandemic, I think it was in late April, I decided to look up slipping rib for the 20th time on Instagram, because I never found anything before. And I guess it was fate, because I came across this girl who actually had a post on Instagram with every single detail of all of her symptoms and the fact that she had surgery and is now better. And I was like, not only does this girl have all my symptoms, and keep in mind, I never met anybody with this, ever, for 5 years. She has all my symptoms, and she had surgery, and she's healed. Like, it didn't seem real. I was hysterical. Like, I found it, I was just crying.
Where was she from?
She was from upstate New York, and she had the surgery not with my surgeon, with a different one in Arizona.
How great is that? Yeah. So fast forward to you go and to the surgeon, and what happens then?
So yeah, so I found a Facebook group, which is important to note just in case, you know, anyone would want to look into it. I found a Facebook group through this girl, and I then came across my surgeon, Dr. Hansen, in West Virginia through the Facebook group. And a lot of people were suggesting him because they had surgery and they had the same symptoms as me, and they were 8, 12, 16 weeks out from surgery and feeling like they were new people. So we made the appointment at the end of April. We waited until, I believe, June 15th. So it was a long, just draining
Oh my
wait.
God, but you must have been so excited to know that there was going to be some relief.
I didn't believe there would be. That's the thing. Because even though I was seeing it, I was just so afraid. So at the time, I mean, again, my mom's like, this is it, but.
Pain with a purpose, though, that's what you sent me. That's what you called this journey of pain with a purpose when you finally were diagnosed and then were able to get that surgery. We need to mention, because we talked during break, and then we need to mention this during the show, that a lot of times if someone is watching this, the symptoms that you had growing up, you actually had other symptoms, like you had your gallbladder out at age 8, right? Isn't that one of the sides of having this?
Yeah, so it turns out, I mean, there's very little known about slipping rib syndrome because it's very misdiagnosed and kind of misunderstood, but I've spoken to 15 or 20 people now at this point that have either had the surgery or at least been diagnosed, and every single one of them had either a gallbladder issue or a stomach issue or Crohn's disease or things like that. And I had stomach issues my whole life growing up, and no one could ever figure it out. And it seems that it's due to the ribs kind of putting pressure on your abdomen, and it affects your whole body. It really does.
Okay, so when you went to your surgeon, I'm sure he examined you and then ordered other tests. So what exactly was the determining factor that you had this, that you were ready for surgery?
It's so funny because he did not order other tests. There was no
Nothing.
need for it. No, and you wouldn't believe it. Like when people ask, because that's a very common question I get, this was diagnosed with his hands. I mean, literally, like he felt my rib cage and he said, you have some major stuff going on in there. And actually, in his words, he said he could play my ribs like piano keys.
So what happens then when, explain like the process of what they actually do for the surgery? What are they actually, like they don't have to break your ribs and move them up? Like if you're born with this, what are they doing with the ribs?
So it's actually a cartilage repair. So the way that his method is called the stabilization procedure, he actually created it himself, which is incredible.
Genius.
I owe like everything to him, honestly, but basically, slipping rib is about your cartilage for your lower false ribs not holding in place properly. And this procedure basically sutures all of that loose cartilage into the right stable
So
place.
for people who can't imagine what you're talking about, we do have ribs that are attached to our sternum.
Yes.
And we get down to the last two ribs, they're sort of floating ribs. They're not attached. So those are the ribs that were giving you a problem?
Yes.
On both sides or just one side?
Just my left side, but it affected my whole left side because most of my pain, honestly, was in like my upper left back. But he said that's very, very common because, I mean, when you think about it, your rib cage is pulling down constantly because it's just slipping. So
this was slipping down in these two loose ribs, or just those two? Were they pushing in on your organs and then affecting the nerve endings?
that's I would say pretty much what it is. I mean, in like simple terms, that's pretty much what I believe was going on. And I also had something called rib tip syndrome, which is where your lowest rib is actually almost touching your hip bone. And it could be maybe from years of just the other slipped ribs. I don't know.
Well, if you picture your rib cage and if it slipped down like this, of course
years
it's going
and years,
to.
yeah.
And then you start trying to adjust for that. That's why the chiropractic adjustment, I guess, released it a little bit and gave you some relief from that.
So Logan, we have about 2 or 3 more minutes. When from there, your recovery, it's an extensive recovery. Did you stay there? Because I know you were posting a lot, documenting that like it's something where do you stay in bed for a few weeks? Are you there at the hospital? What happened then?
I was there for just a few hours. Surprisingly, you wouldn't expect that, and especially during COVID. The surgery was about an hour and a half, start to finish. But yeah, so my mom was able to get me after because she couldn't come in with me because of COVID, which is a whole other story, which is, very upsetting, but understandable. So after the procedure, we stayed at a hotel because it was in West Virginia, and it was right next to the hotel, or the hospital, I'm sorry. Yeah, the hotel and hospital were right next door to each other. And I stayed there for 7 days, and I basically just stayed in bed. I don't really remember much about it. And then the drive home was tough. And then now I'm 8 weeks post-op today, and I'm driving and I'm feeling like kind of like a new person, honestly, still very sore, but the first like 3 or 4 weeks, it's mostly just you're in bed, and it's tough, but it's so worth it. I mean,
Pain with a purpose.
Pain with a purpose. Like I'm gonna tattoo that, honestly.
So do you feel like a new person?
I really do. I honestly, like mentally, I just feel lighter and happier because, I mean, it just causes you so much like distress physically and mentally, and I also just want to be able to like put the message out there and help other people because I know how it feels. And now knowing that I went through it and I've come out on the other side, it gives you hope that like if I could get through that, so could someone else. And I just feel at peace. So.
And the message is don't give up. You know your body. Don't give up. If you think something's wrong, you need to go and you need to go and you need to find answers, right?
Yes, that is absolutely true.
It's amazing that you had, at your young age, that perseverance and the strength and the courage to keep looking and looking and looking and not give up.
Thank you.
You're to be applauded for that. And I hope that anybody that's watching, if you have anything wrong, that you would keep, pursuing and do some of the things you did, the search out there. We have the internet, we have Facebook and all the other means of communication where people are able to pass on some information like you did.
Yeah.
Well, thanks for joining us here. If anyone has any questions about it, they can certainly contact you via Instagram and all of the social media that we have, which is great now with the social distancing.
And you said there's a group on Facebook?
There is a group. It's a private group, but if anyone ever thinks that this could be going on for them, you could always contact me on Instagram and I could help connect you.
Super.
Slipping rib syndrome. Again, very rare, but it happens, and I'm glad you had the help that you needed.
Thank you. Thanks for
Thank you
having
so
me.
much for sharing that with us. Thanks for joining us. I know that we've had a very quick show. We could probably sit here and talk with you all day about it. We're going to follow your progress. And if you have any questions, as we said, give her a call. Watch our commercials. Please go and patronize all of our sponsors. It's through them we're able to bring you these shows, bring all this information. And we want to always thank you for watching The Girls. Stay healthy. We'll see you next time.